Hi, everybody. Welcome to our webinar on registering with the BBMRI ERIC Directory and Negotiator for non-BBMRI biobanks. So that's quite a title for you today. We have people attending from all different time zones. So for some of you, it's Tuesday already. For some of you, it's evening. Some of you are in the morning. So thank you, everybody who made time to join us today. I'll just say a couple brief technical points. So the webinar will be recorded for those of us who were not able to attend in person. So if you have any objections, just let us know. You are muted and are not able to ask questions. So if you have any questions, you can raise the hand. There's a little hand up button you can click on if you want to ask a question during the presentation. And then otherwise, we'll take all the questions at the end as well. So we hope you can stay for the whole thing, and we're looking forward to sharing our info with you. So I'm going to hand it over to Francesco Florindi from BBMRI ERIC, who's going to tell you just a brief intro about what we are and who you're joining here today.
Thank you very much, Caitlin, for kickstarting the webinar, and welcome everyone to this introduction to our directory. Before leaving the floor to Petr, to our real expert on the matter, I just wanted to introduce this webinar and why we have actually this webinar happening in partnership with ISBER. So thanks a lot to our ISBER partners that also helped us to make this happen. I believe I have a few slides. Next. Thanks. So for those of you who might not know, BBMRI is basically the largest biobanking directory in the world. We connect over 600 biobanks in Europe that provide access to over 100 million samples. And today, our mission of today is to make sure that we can actually become a larger directory also for COVID-19 positive samples, and how we can actually give visibility to your biobanks outside of the BBMRI network that could provide useful material for the much needed COVID-19 research. Next. In practice, BBMRI is we can say is an international organization. That would be the easiest way to describe it to those of you who don't know European law that much, and I cannot blame you for that at all. So we are an international organization. Our founders are European ministries of research or health, belonging to 20 European countries. WHO is also a member via its IARC laboratory in Lyon. And we connect the publicly funded biobanks from these countries. So we really have a very large network across Europe. And as you can see, we're also growing outside of Europe. We have a number of experts, and hopefully more members will join, more countries will join in the future. Right? So we're not just a network of governmental organizations and biobanks. We are a strong team with headquartered in Graz. Right now we are around 20 people working full-time or part-time for BBMRI. And that is, again, explains the strength of the organization and how we can react to crises like COVID-19 very, very fast. And that's what we've been trying to do. Next. We've been trying to do that, developing a response based on the core services we provide. So the biobanks that are part of our network, we help them with ethical, societal, and legal issues they may have. We provide them support on quality management. And at the center of today's webinar, we help them with IT tools. But Petr, the head of our IT services, will explain you more about that. So with this background, now you understand that we had to have a strong response to the coronavirus pandemic. And we tried to do that first, building on our strength and our expertise. First and foremost on the directory, on this large search engine for biobanks that we have collected, developing very quickly. And again, congratulations to the IT team, a directory filter that allow researchers to look for those biobanks with COVID-19 positive samples. We also try to rally the community around what are the requirements to collect, share, and preserve these samples. And it was actually very successful. And to do the same for the ethical and legal issues that are linked to collecting these the samples for the new disease. But BBMRI doesn't work in a bubble. We need to be connected with the rest of the research community. We did that first and foremost within Europe, linking up our work with other research infrastructures. We're doing, let's say, complementary work to what BBMRI does. For example, in the field of clinical trial management or translational research, genomics, and so on, we really teamed up with all the other big European players to create a strong joint response. And we also tried to explain to policymakers what's to be done in the future to make sure that the research infrastructures and the research community is stronger for the next pandemic, for the next COVID. And that's something that we're going to continue to do, of course, in the months to come. And much of this, let's say, recommendations come directly from the experts that have been contacting us and the people that have been working with us to develop this response. And finally, because this is a global pandemic and really its effects don't really care much about borders, we've been partnering with ISBER, and it's a global outreach to make sure that we can connect biobanks that are outside of our geographical remit, but they can provide, again, a big support to the global effort in coronavirus research. And then thanks to the ISBER colleagues and the ISBER leadership to make this happen, to be responsive, very fast, and also very open-minded towards this collaboration. This is a great sign, and hopefully this will go on and we can build on this collaboration to do more activities together in the future. But right now, let's focus on what we can do against Corona. If you have any questions or if you have any remark about this webinar, you can always contact us at these addresses. Petr, I think it's time for you to go ahead. Thanks, everyone.
Thank you. Thank you, Francesco. Thank you, Francesco, for the introduction. So I will take over with the presentation on the directory and the negotiator. And as Francesco mentioned, we're actually not a directory. We are a research infrastructure that has been set up with the purpose of facilitating access to quality-defined biological material and data from the biobanks and similar resources. And the directory is one of our services that we're operating for this purpose, and it's not the only one. And of course, with the surge of the COVID pandemics, we tried to adapt our services to facilitate access, in particular to these resources that are relevant for COVID research. So we will be covering two of them today that are relevant. It's the directory and it's the negotiator. The idea behind those two is that in the directory, you should be able to identify biobanks that are relevant from the COVID perspective, that are either providing samples or data, or they're able to set up prospective collections of COVID samples or data, or they are providing some other services that are relevant from COVID's perspective. And then once you have identified the candidate biobanks, you can negotiate access to them and to their services. And this is done via the negotiator. And from the ISBER members and from the international community perspective, we would like to have you integrated in both of those services, because being in the directory basically promotes the visibility and makes you findable, your resource findable within the biobank ecosystem, within the COVID ecosystem. And by being registered as a representative in the negotiator, you're basically able to respond to the requests of the researchers, of the users of those biobanks that are trying to get access to the samples or data. Now, BBMRI normally operates these services primarily for the members of BBMRI. But we have two exceptions here and exemptions given by our members. We're able to include also non-BBMRI biobanks or biobanks from non-members and non-observers of BBMRI for rare diseases and for COVID, because these are global. These are, in case of COVID, are with very rapid onset, and we need to be able to react to such challenges globally and not just given by the borders of the research infrastructure. Before I get to how you register in the directory and in the negotiator, I will show you two more slides on the access procedure, because it's important to understand how the access procedure within BBMRI ecosystem works. And it basically shows you that the BBMRI biobanks enjoy very high level of independence. So the central BBMRI services are only providing a kind of matchmaking and negotiation of access, but then it's up to each biobank that is participating in this ecosystem how they decide to react, if they are willing to share the data, if they're willing to share the samples for a particular purpose, and what type of MTA or DTA, material transfer agreement or data transfer agreement, they need, if there are any ethics vote procedures needed. So this is controlled by the biobank. So hopefully that also somehow relieves the concerns that you might have. BBMRI is not taking over any biobanks or any collections in the biobanks. We're just here to facilitate access, to help you being findable and accessible. So in the initial phase where we start, can you see my cursor moving? Maybe that's for Caitlin or for somebody who has the right to speak. Just a pointer.
Yeah, we can see it.
Yeah. In the initial step, the requester identifies candidate biobanks and their collections. Some of them might turn to be irrelevant because they don't have the material, the particular combination of the material and the data, or they don't have it available for a particular purpose, but they get into the set of candidate biobanks. And then by requesting access, by hitting the button in the directory, they go further to the negotiator, at which point the requester already has to specify a particular purpose for which they are requesting access. So particular research project, particular drug development, particular whatever purpose they need the data or the samples for. And if they have any limitations on the access conditions, or if they're commercial subject or non-for-profit research project or what. And the biobanks can then react in the negotiator platform to this request, and they can do it pretty efficiently in a way that the researcher or the requester doesn't need to call and communicate individually with each biobank. The communication is done on a collective basis, in the sense that once the request is filed, the announcement is distributed to all the candidate biobanks, and then they can communicate either in a group mode within the whole request, or they can also communicate privately or confidentially between the requester and the biobank, depending what information is being exchanged. Because for many requests, they're actually heavily underspecified, and the biobanks typically have to request further specification of what is actually needed for what purpose exactly, what analytical methods are going to be applied, so that they can assess if particular samples are fit for the particular analytical method. And this can be very efficiently done by the group communication within the request, so that one biobank runs this communication, this refinement procedure with the requester, and the others can only enjoy the outcomes of having the sample request or data request better defined. And then the biobanks indicate if they have samples or data available for that particular purpose or not. And then they basically leave the negotiator, they sign the MTA DTA directly between the requester and the biobank and deliver the material. And eventually the requester should report to both the biobank and to BBMRI ERIC when the research project is finished and offer the data back, if there are any data generated by the researcher, by the requester, offer the data back to the biobank to enrich existing data resources. So this is the overall procedure. We have more than just BBMRI ERIC Directory connected to the negotiator platform. So we have also something called Locator, which allows more in-depth search. This is not subject of the webinar today because this is much higher cost from the biobank perspective service in a way that you need to transform all the patient level or donor level data into a connector and make it searchable in a distributed manner. And we're also, for the purpose of rare diseases and rare disease research, we have connected RD Connect Finder that is something similar to the directory, but specifically for the rare disease resources, the biobanks and the registries. So when you're searching in the directory, in the locator, or in the finder, at that moment, you're just browsing, you're searching based on certain search criteria, and you don't need to specify any purpose at that point. Once you go one step further and request the access into the negotiator, you need to specify the access purpose. And this is the major difference between those two, the findability services and the access facilitating services. Typically, BBMRI biobanks can provide access to pseudonymized or anonymized data, and it depends on the request of the researcher. It depends if compatible, if the request is compatible with the purpose for which the biobank has the data, in a sense of informed consent, for instance. So this is the general overview of the whole ecosystem. Since March this year, we're continuously updating BBMRI ERIC Directory to improve its usability for COVID-19 research. So we started with very simple search criteria. If the biobank has any COVID-specific samples or services, and gradually refined it over the time to the state that you can see at the moment. And maybe one thing to keep in mind, the BBMRI ERIC Directory is a service that works on aggregate data descriptors. So it works with two concepts. It's the level of biobank, which is the institutional entity hosting collections of data and biological samples. And it's those collections. These are the actual entities holding the samples and or the data. So when you think about it from this perspective, what type of COVID-specific things you have on the institutional level, on the biobank level, and what do you have on the collection level? So on the institutional level, you have services that are provided by the biobanks regardless if they have samples or not. these are things like availability of, and actually I forgot to put it on the slide here, but you will find it in the directory. If you have BSL 2 or 3 certified laboratories, if you are providing services in antibody development, in protein studies, including protein engineering, animal testing facility, ability to set up clinical trials, virus sequencing facility, and so forth. And these things, these are basically services provided by the biobanks, regardless if they're collecting something prospectively or if they have some retrospective collections. These are typically analytical methods or some other methods that are relevant for COVID. Then when we move to the collection level, you're identifying existing or prospective collections of biological material and data by the disease, of course, for COVID. And as all of you know, the ICD, the International Classification of Diseases, is using some emergency codes for the say pandemics like COVID, and they're in the U07 block. COVID has been assigned 2 codes, U07.1 for laboratory confirmed diagnosis and U07.2 for suspect cases. And in BBMRI directory, we're primarily using ICD-10 codes. And when you start typing COVID, you will immediately get to the U07.1, which is the laboratory confirmed diagnosis code. On the collection level, this is where you already have a retrospective collections or you are collecting something prospectively. The attributes describing the samples and the data are like availability of data on disease, onset, duration, and outcome, data on clinical symptoms, antibodies, different imaging methods related to lungs, blood count, and details of treatment protocol, typically at least what types of drugs were used. And the data model is basically still open for the discussion. We will not be removing anything that would break backward compatibility, but if you have suggestions what should be added to characterize the collections of the material better, then we're always open for suggestions. So feel free to get back to us. So conceptually, how this works is you, as a biobank, a COVID-specific biobank or COVID-relevant biobank, you would have at least the COVID services or one or more collections of COVID material. And when it comes to those collections, please consider them being aggregate statistical descriptors of the COVID biological material that you have in your biobank. So you would provide information on the size of the collection, what types of the data is available, what material types is available, and all of these are put together. And you can, in the future, once we get you through the initial registration procedure, you can further refine those collections. You can create sub-collections with some specific components of what you're collecting. But initially, we would like to fill the data for non-BBMRI biobanks at least with 2 collections. One is if you have existing collections of biological material that contains COVID-19 diagnosis, and if you have ability to collect prospective collection of COVID samples. So each of those would show up as a separate collection. One would be pretty normal collection. If you browse through the BBMRI directory, it's like all the other collections that you have seen there already. But for the prospective collections, it's kind of a dummy collection which is empty, which says 0 samples collected, but it advertises ability of the biobank to collect those collections. So you will be asked about both of those options when filling in the data for us. Now, how would you provide data as a non-BBMRI COVID biobank? Because for BBMRI biobanks, how we do those things normally is through our national nodes. So each of the national node has established some procedure, how they collect this information, how they push it into the directory. In many cases, it's the national node is running their own mini version of the directory where the data is being collected and edited and updated, and then it's pushed through an API, application programming interface, into the BBMRI ERIC directory. This obviously does not work for non-BBMRI biobanks that have no national node of BBMRI. So we have done a very simple Google registration form that allows you to fill in basic information about your biobank, characterization of your existing COVID-19 collections, and characterization of your ability to collect prospective COVID-19 cases. And when filling in that form, you would basically select which of those options you have. So if you have ability to collect prospective cases and you don't have any collection yet, you can of course skip that second section of the form, and vice versa. If you only have existing collection and you will never ever collect anything prospectively, then you can skip the last section of the form, obviously. And I will go through the directory and through the forms in a couple of minutes after I finish the overall presentation, so that you get the big picture. The next step after you are registered in the directory is to register yourself in the negotiator as a representative of a collection or of a biobank. Basically, there is a tutorial which is linked from the slide here that describes in depth with screenshots, guide you through how to register. To make it very simple, there are basically 3 steps. One, because we need to ensure at this point in the negotiator that only the communication can be trusted. So the user, the requester, has to be authenticated, and the biobank representative has to be authenticated and verified that they're really a biobank representative. So for you as a biobank representative, there are basically 2 steps. One is you need to ensure that you have a usable identity to log in into the negotiator. There are 2 ways how you can do it. One is either your home institution participates in some federated authentication and authorization infrastructure, something like EduGain, and you will find a list of institutions that are participating in there, so you can search for your home institution, and if it's participating there, you can try to log in, and that's very easy. Or alternatively, if you don't find your home institution in there, you would register an account in what we call life science hostel service, where you use your email address only and generate a password, provide some personal information about yourself, and you're done. You will need, at this point, you will also need to verify your email address so that you're sent an email to the email address that you have provided, and you need to click on a link that is in that email to tell us that yes, you have really received this this email, and you are in possession of the email address or the inbox. Second, once this is done, you will just provide us with a list of collections IDs that you are representing. wait for your application to be approved. At BBMRI, we're monitoring those applications, and once a new one comes, sometimes we know the person, so we just approve it. Sometimes we don't know the representative, so we work with the biobank, possibly calling you or checking if it's really you who is representing the biobank. There are two caveats that people run into typically. One is, where do I get the collection IDs? So once you find your biobank in the directory, you will find the collection IDs here. So if you go into the detailed view of your collection, it's second line from the top where the ID is. You can also find here on the right side, you can also find the biobank ID if you're interested, because basically this is, I've taken one random COVID collection. This is the prospective collection. So it's the empty one, advertising ability to collect samples prospectively. And you can see what they're offering here, what they're able to collect. And this is their identifier, and this is information about the biobank that is hosting the collection. So this is one caveat. The other typical caveat is that when registering an account in Life Science Hostel, or if you log in through your home institution but decide to change your email address from the one that is provided by your home institution, we will send you that email verification because otherwise we are not certain that you're in possession of that email address. And we are having non-trivial problems even in the directory, making sure that the email addresses that are advertised through it are actually working. So in this sense, it's really necessary to check that the email addresses are working at the time that you're registering in the Life Science Host or in the negotiator. So once you receive that email and once you verify your email address, you will need to go to the registration link again and fill in that list of collection IDs that you're representing. If you go through the fast lane procedure, which is through your home institution, and you don't touch the email address, then you will do it in one go, and you just see the second screen, which shows you the text box with the list of IDs that you want to declare as your representative of. So yeah, so this is it. And before we go into the questions and answers, I will quickly walk you through the directory in the live demonstration, and also through the Google form that you are going to be filling in. So now this is the form that you're supposed to fill in. As I said, so you will fill in your email address, name of your biobank, preferred acronym, description, country, postal address, name of the person who is heading the biobank, contact email, and the juridical person, which means the name of the institution. And please also fill in your geographical coordinates so that we don't need to do an Google geocoding search to try to identify where you are. We will be generating Google Maps soon. Google Maps, sorry. Maps, images of the COVID biobanking ecosystem globally. So this is what we will use the geographical coordinates for. And here you can indicate your extent of the collaboration that is possible for you, if you are able to work with industry or non-for-profit or academic collaborations. If your biobank has access to the following services, so the antibody development, proteomics, animal testing, so forth, what we have already discussed, BSL, and you can also indicate any other services. This is the last thing here is in the future I want to provide the data into the directory via automated upload through the REST API, or I want to edit the data or upload it via Excel or CSVs, or manually upload the data. I mean, because we support both automated and manual uploads of data via Excel and CSVs, or manually editing the data through the web interface of the directory. After you log in into the directory, you can also edit the data if you're a representative of a biobank. And here you choose if you have an existing collection or ability to set up the collection prospectively. And then you go to the next screen, and you will fill the data about each collection. So this is how the directory looks at the moment. So you can see that if I click biobanks that are providing some services related to the COVID-19, we have 58 biobanks. When we also say we're after biobanks that have existing collections or ability to collect cases prospectively, we have 40 biobanks Europe-wide at the moment, and or it's even globally. We have one from Australia, and we have a couple from other non-European countries, and we're of course looking for getting more coverage globally. These are the services that will be advertised, so you can filter for those. Some people ask what is the difference here between clicking the options here and clicking the biobank is providing COVID-19 services. Here the COVID section of the directory has slightly different logic compared to how those facets for directory behave normally. Normally we are using OR logic. So if you select I am into Buffy code and throat swab, for instance, it means I am searching for Buffy code or throat swab, not for both at the same time. So which is indicated by satisfy all being unchecked. While for the COVID services, it is actually AND. So if you are interested in any of the COVID services, you can simply click this button here. And if you want to select a particular combination of the services, so for instance, if they have BSL-3 labs and they're able to set up clinical trials, I apologize for the coughing. Where do I have it? Clinical trials here. So now you can see we have only 3 biobanks that have both BSL-3 facility and clinical trials setup ability. Plus the Buffy code, plus the material types, because I've also selected some material types that not necessarily do not make sense for, Buffy code doesn't necessarily make sense for the COVID. And here I can also specify the COVID, as I've mentioned. So here there are 2 diagnoses immediately coming up, 7.1 for the confirmed cases, and I can also specify the other one for the suspect cases. And again, it's OR, so I'm searching for UO 7.1 or UO 7.2. So this is the directory. Now I can go forward and request samples. This is what the user, the requester, would do. So at that point, they also need to log in, and I will not file the request. I'm already logged in into the negotiator, so I haven't shown you the whole login procedure, but it's in this case, I have logged in through BBMRI as the home institution, and you can already see that at this point I have to fill in the title of the request, project description, request description, if there is ethics vote available, and if I have any attachments, I don't need to copy the project description or ethics vote here. I can just attach them as PDFs, and you can see that there are 5 collections matching the search criteria. So here on the previous screen, if I go sorry, my apology. If I go to the directory, it was 3 biobanks, but it was, oh no, it was actually more than that. But there can be discrepancy in the numbers here, because you might have 5 biobanks. In this case, it is the same, but you might have multiple collections in each biobank that are matching the search criteria. So in this case, it would have been, it could have been, for instance, 3 biobanks with 5 collections. So don't be confused by this. So yes, that's about it. When you go through the registration procedure, you would either self-register in the hostel or log in through your home institution, and at the end you will end up in a on a page that I will show it to you here, because I'm already a representative in the directory and the sample locator, so it won't work for me. But if I try to register for RD Connect, where I'm not a representative of anything, you would get a form like this, where you just copy paste those collection IDs that you're representing and hit the submit button. And at this point, we get a notification that there has been a new application submitted for a representative of a biobank, and we will add you or we will verify your request and eventually add you as a representative into the negotiator. So that's it from my perspective. Thank you very much for your attention. If there are any questions, I'll be more than happy to answer those. Or associated with this venture? No, we're doing it because we're set up as a research infrastructure for this purpose. So we're covering the costs of all of this on our side. And you will need to cover your own costs, your own time to register, and to register in the directory, and then to register into the negotiator. That's it. Are participating institutions allowed to be reimbursed for the operational expenses when a requester is matched with the biobank? Yes, based on the BBMRI access policy, you can be reimbursed up to the full cost of what it takes for providing the samples. So it means you can reimburse. You need to be cost neutral at best, so that you can't make profit, but you can cover the cost that you have with the storage of the particular samples, or with data preparation, or sample preparation, or sample analytical methods that you're applying before you're shipping the data or the samples to the requester. So that is all possible. If you have any further questions, something else comes to your mind later on, don't hesitate and get back to us, possibly at contact@bbmri-eric.eu, or if you have some specific IT-specific question, you can contact me, or go to IT@helpdesk@bbmri-eric.eu, as Francesco has advertised in his presentation.